So the evolution of things in running a practice, you joined Bill and you guys have worked together 10, 15 years now. You helped him really build Cleveland Eye Clinic, Clear Choice Custom LASIK Center into what it is. But then you guys had another evolution that took place just a few years ago, right before the pandemic, which was the merger with private equity.
Right.
What was that discussion like before that happened, and what ultimately led to making that decision?
Sure. So it's anytime you look at change, it's something that is very difficult. It's very challenging. You never know what to expect, things like that. And I think we've always continued to keep on expanding. And I think pre-private equity, one of the discussions Bill and I had was just kind of looking out at the future, trying to determine what is the best way that we can continue to keep growing. Because in our minds, if you remain static, that's basically the start of working downwards. I mean, you got to keep on working. How do you keep on growing, improving, things like that? So in our minds, we basically were trying to see what is the best way where we can continue to keep growing, expanding the whole market per se. And the two choices we were presented, I mean, we basically had three choices. One is continue to do it organically, which is what we've been doing for a period of time. The challenge with that is obviously between Bill and I mean, there's only a certain amount of capital that we have. So we're sort of limited as far as what we could potentially do. And a certain amount of time that we have. Time is, we're very busy surgeons, so we don't have that much extra time inside them. Second thing is looking at hospital systems in the area. And over here, we did not feel that that really would be a way that we could potentially keep on growing. Or PE, private equity, was another methodology that we said that we can potentially grow. Now, many people view PE as an exit strategy or a way that you can maybe get some windfall of money and kind of move on. But our view of PE was, which methodology did we feel we would be most successful in terms of being able to continue to grow things and things of that nature? And when we eventually partnered up with PE, and again, I want to make a clear distinction here, is that I typically will not use the word that we sold to PE. I love saying the word that we partnered up with PE. I view our PE partner as one that has helped us to grow, continue to evolve, things like that. And I will say that everyone's PE journey is very, very unique and very, very different. I think people on the outside that may have not been involved in PE may think that PE equals PE. And what I've realized having gone through the process is that it can vary so much depending upon who your potential partner is. When Bill and I started exploring this, we basically had like maybe 20 different offers from individuals that wanted to go ahead and work with us. And what you realize when you go down and sit with all these individuals is what ends up happening can be very, very different. I mean, you can be in a situation where they completely take over, your style of practice changes, things of that nature. From our standpoint, we felt that we were still relatively young. We wanted to keep on growing. So we wanted to be in a situation where we may not necessarily take the most amount of money that was being offered, but we want to make sure whoever our partner was one that would continue to give us the autonomy to continue to grow and evolve the way we'd like to. So we're fortunate to join up with Midwest Vision Partners, which is backed by Alpine, back in December of 2019. And I think the thing that we gravitated towards that is that we felt that they as a group would be someone that would let us continue to practice the way we wanted to practice. And a lot of people come back to us and ask us, so what changed after you partnered up with PE? And the best answer I have, which I can honestly tell them, is I felt like nothing changed. I mean, Bill and I continue to do what we're doing in the sense that another type of PE partner may have come back and looked at us and say, hey, we want you to cut back in how many conferences you attend, because when you go to conferences, you're taking time away from clinic. That's time when you could be productive and things like that. The individual that we've chosen with MVP, they encourage us to continue to present. They encourage us to continue to do research. We still have the same amount of, they want us to practice the way we were practicing before. So the amount of time off before we're still taking the same type of time off as before. And overall, I think it's been phenomenal for us. We've continued to keep growing and continue to keep evolving from that standpoint. But that was a big change that took place. But looking back, I can tell you that going through it was one of the best decisions we ever made.